The Ammon Foundation launched in October 2016 as the philanthropic endeavor of Ammon Labs, with Mariel Hufnagel on board as executive director. Its mission is to empower individuals in addiction recovery through combating stigma and providing strategic support to enable personal success. Mariel Hufnagel received a Master of Arts in Public Administration from Kean University in Linden, New Jersey, with a summa cum laude distinction and a GPA of 4.0. In an effort to bring a face and a voice to recovery, as well as to demand the civil rights of those who suffer, those who have lost their battle, and those in recovery, Mariel has immersed herself wholeheartedly in the work of mental health, addiction, and criminal justice reform. Prior to coming to the Ammon Foundation, Mariel worked as an advocacy organizer with the New Jersey chapter of the National Council on Alcoholism and Drug Dependence, and as the national chapter manager for young people in recovery.
My connection to the recovery field is personal. I'm a person in long-term recovery, which for me means I've been alcohol and drug-free from a crippling heroin and crack cocaine addiction since May 2007. I was able to get sober at the young age of 21. That's an important story to tell. People are getting well all across the country and the world. So many people at the same time are suffering and dying from addiction, not connected to the idea that recovery is real or that recovery is possible. And I very much feel an onus to let people know so that they don't have to suffer in shame and in silence, that they too can get well. When we enter into recovery, there becomes this feeling or this obligation to want to give back. And so early in my recovery, I was involved more in a treatment capacity, running a halfway house, helping and mentoring a lot of young women. And what I realized when I was about 5 years in recovery is that the work that I had done was incredible, and I wouldn't change it or take it back, but it was very much about this micro effect, right? So I'm helping you, the person sitting or standing in front of me, to get well. And when I was about 5 or 6 years in recovery, it was the same time that the Anonymous People came out by Greg Williams, I really got tapped into and in touch with the idea that my impact could be much greater than the person who was directly in front of me. That it could be about creating some systemic change and this ripple effect that would help hundreds, if not thousands, if not millions of people for years to come in making recovery more visible and making recovery more accessible. The Ammon Foundation is a product of corporate philanthropy, and I think that that's really important to say it louder for the people in the back, because when we look at all social justice causes, you have philanthropic money coming in from all areas. Because addiction is not sexy or popular and is so shrouded in and stigmatized, there's not a lot of philanthropic dollars coming in to the addiction and the recovery space. And in order to stem the tide of addiction, we have to have philanthropic dollars coming in. It's important to own that Ammon Foundation is a product of corporate philanthropy, really having the corporate sector identify, recognize, and own that they have a role through corporate responsibility, through social responsibility, to give back in the addiction space. The story behind it is really beautiful. The CEO and founder of Ammon Labs, Steve Haupt, entered treatment for his alcoholism in early 2016. And through his process of entering recovery and getting well, he noticed there were people cycling in and out of the treatment center he was in. And so he started asking these questions about, well, what happens after treatment, right? And realized what I really think is something profound, right? That treatment's not necessarily the issue. And we could get stuck down that rabbit hole about good treatment or enough treatment. But treatment does exist. But post-treatment, what's going on? And really that idea that many people are going to treatment and then have nothing afterwards to help them rebuild their lives. And so Steve had this idea of how do we help people after treatment? That's what I want to help with. And right around that time, SAMHSA also had come out with some data that showed unfortunately, the really dismal recovery rates. 3 out of 10 people who engaged in some sort of treatment process within 2 years, only 3 of them were able to maintain their recovery. But then juxtapose it with some interesting data that out of that pool, people who went to treatment and then pursued education, 7 out of 10 of them were maintaining their recovery. So as a person in recovery, that makes sense to me. As someone who's gone back to school in recovery, that makes sense to me because education and school does 2 things. One, it levels the playing field, right? And we've seen that in all sorts of other arenas, whether it's immigrants, first-gen students, poverty, right? Education is that stepping stone. 2, there's more to being a student than just the diploma. As a student, you learn about yourself, you learn what you're good about, you learn good at, bad at, passionate about, what your skills are. It builds self-confidence and leadership abilities, and all of those things tack into recovery capital. So if I'm in recovery, learning that I'm a leader, learning what I'm good at, learning that I have passion and purpose and the ability to, build a life and a career, as well as then I'm on this stepping stone that leads me to safe housing, adequate health care, stable employment, all of those things, I'm really enhancing and reinforcing my ability to stay well. So that's the story of how the Ammon Foundation came to fruition. One man, right, got sober, wanted to help other people, and decided to create this entity. We give scholarships away for people in recovery to go to college or vocational and trade school. We just celebrated our 3-year anniversary in October, and to date we've given $200,000 away in scholarships, which is an incredible number, helping over 100 people to not only get education, but to really realize their dreams and build these lives worth living. And anyone who knows me, that's almost like my tagline, right? That we have to help people build lives of purpose, worth, and meaning. Because if I can help you, or if someone in recovery can live a life worth living, I'm not saying relapse is impossible, right? And I'm also not saying that circumstances need to be perfect in order to not re-engage in use, because that's unrealistic also. Let's be real, life is hard and throws you curveballs all the time. But if you can live with purpose, worth, and meaning, if you can be excited about things and passionate about things, if you can be supported by community, there's a much higher likelihood that you're not going to re-engage in use, especially when life gets hard. And so my role there is I really have the privilege of being the foundation's executive director, which has allowed me the very cool opportunity as a person in recovery, as a young professional, to be involved with the founding of an organization at the very early inception stage. And I've also had the really unique opportunity to build something and mold it and see very much a vision and a dream come to fruition. If we talk about addiction and we talk about recovery, we can't talk about it without talking about stigma. Addiction is not viewed and treated as a public health issue, as a chronic relapsing health condition. It's viewed and treated as a moral failing. People who have suffered from addiction are looked down upon, and it's very much still based in this idea of bad choices. And I'm not going to say that people who suffer from an addiction don't make bad choices. That's not the counter argument. We can all have opinions, but science and data very clearly shows us what addiction does to the brain and how people are genetically predisposed to suffer from it. That's fact. Science shows us. What's not fact, and what's difficult, I understand, to digest about, say, addiction versus cancer, is symptomatically addiction is ugly. And the things that happen when your brain gets hijacked and you are suffering from an active substance use disorder don't look like any other chronic relapsing treatable disease. So I want to say I understand that it's less palatable to empathetically, compassionately, and lovingly look at someone who's suffering from addiction, who is acting out, who is hateful, who is rageful, who is stealing, who is breaking the law, who is hurting, themselves, their loved ones, and the community around them. So I understand what perpetuates some of that contempt, some of that disbelief, and some of that ignorance. Let's look at something like cancer next to something like addiction, or diabetes next to something like addiction, both of which I have personal experience within my family. And I always tell these personal stories because I think they liken them very well. So my uncle was diagnosed with diabetes, morbidly obese, right? When he was diagnosed with diabetes, he was never shamed for his lifestyle. Insurance never challenged covering his treatment. And certainly there were lifestyle changes suggested by his medical team. He refused to make any of those lifestyle changes. They didn't refuse to continue medicating him, providing services, or meeting him where he was. Right? And eventually, unfortunately, what happened to my uncle is his condition progressed. He ended up needing fingers and then toes to be amputated, and he died. He died from his diabetes. And one could very much say that he made choices, lifestyle choices, that facilitated or at least sped up, that his death. However, he wasn't shamed for it. His family wasn't shamed for it. Insurance covered everything, and it was treated like the chronic, progressive, treatable disease that it is. So how would that be any different than someone suffering from addiction? The same thing with cancer. My mother was diagnosed with breast cancer. It was stage 2. They didn't say, you know what, Lorraine, why don't you come back when it's stage 4 and we'll treat it then, right? They said, let's treat it now. Let's treat it aggressively. Luckily, my mother is in remission from her breast cancer for many years at this point. What I think is important in the comparison with the breast cancer, on her last day of treatment, right? They didn't say, you're cancer-free, high five, see you later. They said, this is going to be your recovery and wellness plan, Lorraine. And this is what you need to do because cancer is chronic and relapsing, right? And so it included follow-up doctor appointments. It included some lifestyle changes with her diet and with her home. And then what it also included was it included recovery support. So they said, so you live in Westport, Connecticut, Lorraine, in Fairfield, Connecticut, which is 15 minutes down the road. There's a survivors community center where survivors from cancer get together and they support each other. There's free meditation, there's free exercise, there's all of these holistic services because your wellness is not just one part. And so we want to support your recovery so that your cancer doesn't come out of remission. And again, I challenge, how is that different from addiction? And the answer is it's vastly different in practice from addiction. Recovery support services are practically non-existent. Treatment for addiction is absolutely acute, and it is in no way early identification, intervention, and prevention. We wait until people are dying in what might be considered a terminal or 4th stage substance use disorder before we aggressively step in. And with diabetes, it's the same. Healthy lifestyle decisions and choices are being made by an individual, whether by free will or not an argument I want to get into, but being made that are hurting somebody. And yet somebody with diabetes is loved and supported and treated, whereas somebody who suffers from addiction is shunned and shamed. So I just think those comparisons are important. So how does that connect to political action? The bottom line is our elected officials work for us. We vote for them, and our opinions matter. And so if people were to become a constituency of consequence around addiction as a public health issue, our leaders, our political leaders, would be forced to take action, create legislation, and change the way that addiction is treated in our country. We have not yet become that constituency of consequence. My experience has been that we start small. There's a place for everyone in that becoming a constituency of consequence. And it's about whether it's about visiting your legislator or writing a letter or going to a hearing. There's a place and a role for everyone to fit into that. But until the voices of treat addiction as a public health issue are louder than addicts or scumbags and lowlifes and junkies and, like that narrative, until the public health narrative gets louder than the stigmatized, sensationalized narrative about addiction, we're going to continue to see minimal political action. The opioid epidemic, in which we talk about now, has infiltrated, white suburban America, seemingly afflicted in a larger way than politicians are taking notice, because white suburban America makes up most of our voter base and most of political donor base. So there's a need for this greater attention. In the 80s, when the Black community was decimated by the crack epidemic, which is no different than the opioid epidemic, it was treated very, very differently. So my hope is that we can get justice for all, and really capitalize on the momentum that is currently existing with the opioid epidemic by really looking at it as an addiction epidemic, which we've had for decades. We will never be able to stem the tide of addiction unless everybody gets on board. And everybody is probably an unrealistic, net, but at least it's it's the idea that every stakeholder, whether it's the cashier at the supermarket or the president of the United States, everyone has a role in this. Some of it is just talking to your neighbor, right? And some of it is testifying at legislative hearings about antiquated and draconian legislation, right? It looks totally multifaceted, and it looks totally different based on who the person is and what their role is. I very much think of addiction and mental health as a social justice cause. It was one thing for people who were impacted by HIV, or people who were LGBTQ, or people who were female, to stand up and be like, hey, I have this, or I am this, because I certainly don't want to make LGBTQ or being female seem like a condition that you have, but I have this, or I am this, and I deserve rights, or I deserve respect, or whatever that is. That's great. However, none of those movements were able to really get past a plateau until people who weren't that or weren't afflicted or impacted directly stood up also. So when people started saying, oh, wow, like, I'm not LGBTQ, but LGBTQ people deserve rights, right? There was a broader net was cast, and more people started listening, because I think our very human nature is we connect with and we listen to people who are like us, and we respect people who are like us. That's just human nature. And so as this net casts, for someone who potentially is not directly impacted, has no experience, and maybe has some fear or some confusion about a subject or a type of person, to have someone who looks like them or talks like them or has had similar experiences can really help to facilitate this paradigm shift that has to occur in our psyche. And so specifically with addiction, although now if you look at some statistics, I don't think there's anybody in America who's not impacted in one way or another by addiction, whether it's a loved one, a colleague. We need people who are not directly impacted to be equally as much advocating as those of us who are directly impacted. Draconian and antiquated legislation and policies that really continue to fuel health disparities and the lack of health equity amongst all people. Some of the systemic and institutional racism, and not just racism, but also segregation and separation of anyone who's not upper middle class, people of color, which would include people of Hispanic descent, the LGBTQ population, and those with a lower socioeconomic status less likely to access or seek treatment, less likely to ask for help when it comes to addiction and mental health. And so clearly there's something wrong there and broken there. Then if we look specifically at services, I'm a big advocate for prevention. It's not my wheelhouse, but I think absolutely if we can prevent something before it happens, I'm all for it. However, I think a lot of our prevention is ineffective. The abstinence model with sex. We can't just tell people not to have sex, they're going to get chlamydia and die, right? You can certainly talk about the dangers effectively and suggest that people wait to have sex, but then you also have to have sex education and offer condoms, and then also have some harm reduction if people do engage in risky sex. So it's the same thing with addiction, right? It can't just be like, drugs are bad, don't use them, you're going to die. There has to be prevention that's realistic. And in my humble opinion, it also really has to do with coping mechanisms and building healthy and resilient children, so that people don't have the need, based on this emptiness and this low self-esteem and this inability to manage what's going on in their life, the need or want to turn to substances. So that's prevention. Then there's a ton that could be improved with treatment. Treatment really should be available long-term, on demand for all individuals, regardless of the ability to pay. Again, now we're in this utopic view. I know that's probably unrealistic, right? But what's also completely ineffective is that I have an insurance plan that pays for 3 days of detox, and then that's the end of my treatment plan, right? Like, that's not effective either. So hopefully we can land somewhere in the middle. If we buy in to the idea that addiction is chronic, progressive, and treatable, the day I leave treatment is the beginning of my recovery, not the end of my recovery process, right? And so what type of support is needed to help build people up in their recovery in order to have them be able to maintain and sustain that recovery? And there's no cookie cutter answer for that, because everybody is different, looks different, comes from different life circumstances, and, gets to that point differently, right? So it could be anything from education help, employment help, housing help. It also could just be, maybe there's criminal justice involvement. Like, there's so many different facets there, but the idea of how do we help someone to live this life worth living, right? And what are the barriers in place there that need to be removed in order for said person to be able to do so.